Atrium Health Foundation is the philanthropic arm supporting most of the Charlotte region of Atrium Health. All of the money we raise goes directly back to enhance the care we provide to our patients and fellow teammates. Philanthropy actually means the love of people. So at Atrium Health Foundation, we believe in developing relationships. We inspire transformational giving to improve health, elevate hope, and advance healing for all. We manage over 200 funds that support facilities, education, research and innovations, world-class programs, and community initiatives. Many of these funds are started by grateful patients.
I give because I am a 2-time breast cancer survivor, and as a survivor, I had access to the best diagnostic tools and quality health care, which I know can be the difference between life and death for someone.
You know, insurance will pay for mammograms, they'll pay for surgery, they'll pay for chemotherapy. They don't pay for outreach. They don't pay for navigation. They don't pay for Tai Chi. They don't pay for long-term follow-up care. So all of those things that are just essential to the care of a woman with breast cancer, we couldn't do it without philanthropy.
Philanthropy really helps us tremendously. To have a strong philanthropic arm, it helps tell the story when we're trying to recruit others to our organization.
I went and saw the Sanger heart transplant and failure team and was diagnosed with a heart that was in such bad shape that I required a heart transplant. When I first came to Sanger, I realized I had an entire team around me. There were, I think, 5 doctors that will monitor me leading up to the transplant and will monitor me for the rest of my life. I am here because someone gave of themselves and gave me a life with a new heart. The other gift is philanthropy. That type of giving helps Sanger attract the best doctors, have the best resources available, which in turn helps people like myself to go through the process and come out the other side and thrive in life.
There's a strong belief by those in the community in the work that we're doing. That financial support speaks volumes because it provides an extra sense of authenticity or legitimacy to what it is that we're trying to aspire, or what we're trying to accomplish.
So before I got involved with the maternal wellness group, I think I can describe it as just kind of not really knowing what was going to happen and being so happy that I had this healthy baby and just being so in love with my baby, but then on the other side of it being so sad and depressed.
We started the maternal wellness program in August of 2017 with a psychoeducational group to support women struggling with mood and anxiety disorders related to pregnancy. We have therapists who've been specially trained to work with this population and nurses who had additional education in obstetrics, and then psychiatrists who have also had additional training in medication. We really see this as serving Atrium Health in addressing the needs of patients across the life spectrum with health and healing and hope for all.
What sets Carolina's rehabilitation apart from other facilities is the wide scope that we have. We take care of the most complex traumatic brain injuries, spinal cord injuries, stroke patients. We take care of cancer patients, amputees, and some of the most complex surgical and medical patients.
Carolina's rehabilitation is a place that cares. We've got some very gifted doctors and physical therapists, occupational therapists, recreational therapists that truly care about the patient. And that gives you the confidence to deal with what you're going through.
The reason that Atrium Health and Carolina's rehabilitation is so fantastic ultimately is the people.
Back in 2012 in Afghanistan, I stepped on an IED.
Bo was brought to us because he was so severely injured. He had multiple extremity injuries.
I lost my legs and it pretty much blew my arm off.
Shortly after I got here, we started a limb lengthening deformity service, and the concept of that service was to provide limb lengthening, bone transport, and that type of reconstructive surgery similar to the things that I'd done in the military for injuries that were probably not reconstructible in the past.
Gifts in support of our orthopedic program help physicians provide innovative treatments to patients. Gifts also provide continuing education and research opportunities for physicians. Grateful patients, grateful teammates, you make the difference.